Okay, so this will be part 2 for the 33rd day, March 11th, on pulmonary examination and rehabilitation. Part 2, we're going to focus on the postural drainage. Again, precautions for the use of the Trendelenburg position, circulatory, congestive heart failure, and hypertension, pulmonary edema, shortness of breath made worse with Trendelenburg position, had a bed lower than foot, abdominal, obesity, abdominal distension, hiatal hernia, nausea, and recent food consumption. Precautions for the use of the sideline position, vascular axillofemoral bypass graft, musculoskeletal, arthritis, recent rib fracture, shoulder bursitis, or tendonitis, any condition that would make appropriate postural drainage positioning uncomfortable. So I went and I pulled some pictures out of the Netters. So here's a picture of your lungs here. So on the right side, we have the superior lobe, you have the middle lobe, and the inferior lobe. And on the left side, we have the superior lobe and the inferior lobe. So the right side has more, superior, middle, inferior, and the left side has superior and inferior. So these are the bronchopulmonary segments. Right lung, left lung, apical, anterior, posterior. On the right, superior, you have apical, posterior, and anterior, blue. Posterior is in green. Apical is in red on the right side, and apical posterior is in red on the left side. So the anterior posterior is divided up into red and green on the right and just red on the left. You have the blue part, which is the anterior part of the superior lobe. The middle lobe on the right is lateral and medial. So you have a beige color and then a brown color. No middle lobe on the left side, but you have a lingular, superior and inferior. So the lingular kind of corresponds with the middle lobe on the right, which is beige and brown, superior, inferior. And then the inferior lobe, you have your anterior basal, your medial basal, your lateral basal, and your posterior basal of the inferior lobes. And this is the anterior view. On the left side, you have your anterior medial basal, you have your posterior basal, and then you have your lateral basal. Posterior view, which is where you're going to see the spinal T1 to T10. T1 to T10. Left lung, superior lobe, your apical posterior. So it's left is on the right, the left side down, because we're looking at the posterior view. And then you have your superior lobe on the right, you have your apical, which is in red, your posterior in green, and your anterior is in blue. Then the left lung has the lingular superior, which is in the beige. And then the middle lobe, the lateral part, which is here, in beige. So the middle lobe you see mostly, and the lingular lobes on the left, you see mostly from the anterior perspective. And posterior perspective, you're not going to see much of the lingular. or the middle lobe. So the posterior view, you're going to see the inferior lobes on both sides. The superior is in purple here, superior of the inferior lobe. You have lateral basal, which is in brown, lateral basal here. Then you have posterior basal, which is in gold, posterior basal, and this is the posterior view. So you see the inferior lobe mostly from the posterior view, and then you see the middle lobe and the superior lingular, the lingular and the middle lobe from the anterior view. Over here on your right is the lateral views and the medial views. So laterally on your right, lung, apical, posterior, anterior, right side. Middle lobe, you're going to see medial, lateral. Inferior lobe, you see superior, anterior, lateral. Anterior basal, lateral basal. On the left lung, lateral view, superior lobe, apical posterior in red. Your anterior is in blue. The lingular superior is in beige. Inferior is in brown. Inferior lobe, you have the superior in purple, intermedials in yellow, and then the lateral basals in this darker brown color. So, and those are the medial views. Here's the trachea and the major bronchi. I like this view because it shows the trachea merging into the bronchi. These three here are going to the superior lobe. These two right here are going to the middle lobe. And these right here goes into the inferior lobe. And then over on this side you have superior lobe here, left side, to the lingula right here, and then to the inferior lobe here. And this kind of breaks it down even more over on this right side of the screen. Lymph vessels and nodes of lung. I like this because it really shows how the trachea merges into the bronchi and then goes into the lobes. So on the right side, you have the superior, middle, inferior. And then over here, you have your superior and inferior. Pretty cool. Okay. And this shows a picture of the lungs inside the body and the level where your clavicle and your scapula and your nipple and your ribs and how all that is positioned. So starting with the first one, upper lobes, apical segments, bed or drainage table flat. So the patient would be either in the bed or on a drainage table with it flat. The patient leans back on a pillow at 30-degree angle against the therapist. Therapist claps with marked cupped hand over area between the clavicle and the top of the scapula on both sides. So this is the apical segments between the clavicle and the top of the scapula on both sides. Upper lobes, posterior segments. Okay. The patient's going to be on a bed or a drainage table with it flat. The patient leans over a folded pillow at a 30-degree angle. Therapist stands behind and claps over upper back on both sides. Posterior segments here and here. Upper lobes, anterior segments on a bed or drainage table flat. Patient lays back on a pillow with pillow under the knees. Therapist claps between the clavicle and the nipple on each side. So here's the clavicle, the nipple, anterior segments here and here. Right middle lobe. The foot of the table or bed is elevated 16 inches. Patient lies head down on left side and rotates 1/4 turn backward. Pillow may be placed behind from shoulder to hip. Knees should be flexed. Therapist claps over right nipple area. In females with breast development or tenderness, use cupped hand with heel of hand under armpit and fingers extending forward beneath the breast. So this is for the right middle lobe. There is no left middle lobe. There's a left lingular, but not a middle lobe. Right middle lobe. Okay, left upper lobe, lingular segments. This says singular, but the book says lingular than others. Patient lies head down on right side and rotates 1/4 turn backward. Pillow may be placed behind the shoulder to hip. Knees should be flexed. Therapist claps with moderately cupped hand over left nipple area. In females with breast development or tenderness, use cupped hand with heel of hand under armpit and fingers extending forward beneath the breast. This is for the left upper lobe, lingular segment. Lower lobes, anterior basal segments. Foot of table or bed elevated 20 inches. Patient lies on side, head down, pillow under knees. Therapist claps with slightly cupped hand over lower ribs. Position shown is for drainage of left anterior basal segment. To drain the right anterior basal segment, the patient should be on the left side in the same posture. Lower lobes, lateral basal segments. Patient lies on abdomen, head down, then rotates 1/4 turn upward. Upper leg is flexed under pillow for support. Notice the end of the bed is elevated 20 inches. Therapist claps over uppermost portion of lower ribs. Position shown is for drainage of right lateral basal segment. To drain the left lateral basal segment, patient should lie on the right side in the same posture. Lower lobes, posterior basal segment. Foot of table or bed is elevated 20 inches. Patient lies on abdomen, head down with pillow under hips. Therapist claps over lower ribs close to spine on each side. Posterior basal segments. Lower lobes, superior segments. Bed of table is flat. Patient lies on abdomen with 2 pillows under hips. Therapist claps over middle of back at tip of scapula on either side of the spine. And then these lower lobes, superior segments. To me, that looks a little high for the lower lobes. That would be superior lobes. Lower lobes would be down here. So, to me, that looks a little high. Okay, again, here's the pictures again. So here's the inferior lobes, posterior view, inferior lobe, superior segments. So that's about at T4, T5 is your lower lobes, inferior lobes, superior segments. To me, that is too high. So what we say, T5, 6, T4, T5, superior segments is more like right there. At tip of scapula, over the middle of the back, okay? Middle of the back, tip of the scapula, which I guess that would be the tip right there. And again, as we see, the superior is right at the middle of it is probably between T4 and T5. And here's T4 and T5. Okay, so this is just for repetition. Upper lobes, apical segments. Okay, red, apical. Superior lobe, apical segment, right here. Patient leans back on pillow at 30-degree angle against therapist. Claps with markedly cupped hand over area between the clavicle and top of scapula on each side. So the apical area is T1, T2 area, and we got T1, T2. Oh, right there. Oops. Up a little bit here. Right in there. Okay. Upper lobe's posterior segments. So here's the superior lobe. The posterior segment on the right is right about here at T2, T3. We got T2, T3. And on this side, again, it is about T2, T3. About right there. Posterior segments. Patient leans over folded pillow at 30-degree angle. Therapist stands behind and claps over upper back on both sides. Upper lobes, anterior segments. Anterior segment here and here. So we don't have the spinal segments to guide us, but it's pretty much a pretty big area. So it's upper lobe right in here. Upper lobe. Therapist clasp between the clavicle and the nipple on each side. You can go between the clavicle and the nipple, and you're pretty much going to get that area. This one. Yeah. Upper lobes, anterior segments. Right middle lobe, there is no left middle lobe. There's a left lingular, but there is not a middle lobe. Anterior, middle lobes and lingular lobes are seen more in the anterior view, middle and lingular anterior view. So they've got ribs to guide. Got under the third rib, the fourth and the fifth rib region. Probably the middle would be the fourth rib region. The bed is elevated 16 inches. In a couple of videos I watched, the 16 is not always 16. Sometimes they say it's 12 inches. Okay, pillows may be placed behind the shoulder to the hip. Okay, so fourth rib, right about the fourth rib, right about over the right nipple area. Yeah, that's where your fourth rib is going to be. Right nipple area, right middle lobe. Left upper lobe, singular, lingular, that notice says lingular segments. Left upper lobe, lingular segments. Anterior, 16 inches up. So this one says 16, that one says. So for the lingular and the right middle lobe, and that's the two, that's 16 inches. Yeah. So for the middle lobe and the lingular lobe, 16 inches. Patient lies head down on right side and rotates a quarter turn backward. Pillow may be placed behind the shoulder to the hip. Knee should be flexed. So where is the lingular lobe? On the left side. Patient's laying on the right side. Left side is superior. So lingular, superior, and inferior segments are going to be right at rib, between rib 4 and rib 5. Rib 4, rib 5. Anterior. In the bed, elevated, Trendelenburg. So as we move on down, we got lower lobes, anterior basal, lateral basal, posterior basal. So anterior, lateral, and posterior. Okay. 20 inches elevation. So the basal, anterior, lateral, and superior, the Trendelenburg 20 inches. The middle and lingular lobes are 16 inches. The lower lobes enter lateral and posterior is 16 inches. So anterior basal, where are they? Anterior basal. So lateral view, here's a lateral view. You can see it pretty good in the lateral view. That's why this patient is in sideline pretty much. So lower lobes. Anterior view, you do not see the lower lobes that well. You see it posterior and you see it laterally. Anterior, the lower lobes are not seen really in an anterior view. So, lower lobes, anterior basal segments, the yellow part here. This is the lateral view on the side. The patient's on its side. That's why the patient is on the side for the lower lobes, anterior basal, because this is lateral view. This is where you're seeing the lateral views. Okay? It looks like the lateral basal, no, anterior, we're on anterior, sorry. Anterior basal is the yellow. Anterior basal is the yellow. So the anterior basal looks like it's about right underneath rib 5, between rib 5 and rib 6. Right there. Anterior basal. And right there. Okay? So we got rib 5, right under rib 5. Be ready to count some ribs. Right, there's rib 5 right there. There's rib 5. So lateral basal. I'm sorry. Anterior basal. Lateral view. Okay, lateral view. That's why I keep saying lateral. Lateral view. The anterior basal is seen mostly in the lateral view. So your patient's going to be in sideline. Okay, move on. Lower lobes. Now we're at the lateral basal segments. So the patient is still pretty much lateral sideline, in sideline, so you can get to that. You're not going to see that part of the lung in an anterior view. You're probably going to see it a little bit in a posterior view. Let's see, yep. Let me pause this and go get a posterior view. Okay, resuming. Lower lobes, lateral basal segments. I went and got a posterior view. Like I said before, you're not going to see the lower lobes, lateral basal segments in anterior view. You're going to see them in a lateral view and a posterior view. So, this is anterior. So, why do we have an anterior view of the body? We should have a posterior view. For the lateral basal, because you don't really see them probably at all. You're going to see them in a lateral and a posterior view. So, we're going to go pause and change this. Okay, so now we have the right view. Posterior view, posterior view. Lateral basal, lower lobes, lateral basal segments is in brown. Not going to see them anterior, you're going to see them lateral and posterior. So it looks like it's in the middle of it. It's probably going to be rib 8. So here's rib 8. We're going to bring it down to about right here. So you really see them in the lateral view, lateral and posterior. This is a little high. We're thinking about right here. Yep. Lateral basal segments. Posterior view. Lateral basal, lateral basal. Now we're in the lower lobes posterior basal. So you'll notice that your anterior and your lateral are going to be almost in sideline. And then your posterior basal is going to be prone. So posterior basal, because where they're medial, the posterior basal segments are medial towards the spine. That's why you're going to be prone. And again, the end of the bed is going to be 20 inches because all of the basals are 20 inches. Anterior, lateral, and posterior basal. So here we go, right here. Head down with pillow on your hips. So your posterior basal is rib, let's see, T6, 7, and 8 area. T6, 7, and 8. 6, 7, and 8. So that's a little low. So we're about there. Right there. And medial. Okay. Then the lower lobes, superior segments. Lower superior is what's in purple here. We have T3, 4, 5. So about rib 5, T4, T5 region. 3, 4. T4 is about the middle part of it. T4. Yep. And that's your superior segments of your lower lobes. So lower lobes, posterior view. You're going to get the superior segments. T3, 4, 5 region. Okay, rib 4, 5, 6 region. Rib 5 is about where the middle part is. You can see it in the lateral view, but it's really mostly seen in your posterior view. This is the reason why he is prone. Okay, so then for more repetition, I focused it on positioning. Seated, your apical and your posterior segments of your upper lobes. So seated, you're going to get your apical here, segments here, and then your posterior segments, posterior in green over here, and red on the left. So, apical, superior lobe, posterior superior lobe, seated. Then when supine, you're going to get your anterior segments of your upper lobes. As you can see that mostly in an anterior view, right here. Anterior segment. And I said side lighting, sort of. Your singular segments and your middle lobe. So on the right side, you have a middle lobe here. On the left side, you have singular segments, which is your superior inferior. That's anterior. Okay. And then your anterior and lateral basal segments of your lower lobes, you are going to get, so the purple here is your anterior basal. Anterior basal, right here, anterior view. So you're really going to see your anterior basal segments in the sideline view. Add a sideline view. But that's where you're going to see your anterior basal, which is the yellow right here. A sideline view. That's why your hands are going to be cupped, and you're going to really be going lateral on the trunk to do your treatment. So the anterior basal is seen mostly in the sideline view. Anterior basal. See that? Lateral view. The yellow part right here. And then your lateral basal here. Posterior view. Lateral basal. Now, right here in the brown. Lateral basal. So those are seen posterior view and lateral view. You can see them. Lateral basal. Here. Anterior basal. Anterior basal. Lateral basal. Anterior basal. Lateral basal. And then you have to probe. Your lower lobe superior segments and your lower lobe's posterior basal. Posterior basals here. And then your lower lobe superior. That is not correct. Bring these down. Lower lobe superior segment is here and here. Purple and the purple. Lower lobes, inferior lobes, superior segments here in the purple. Lower lobes, posterior basal segments here in the orange. And that is by position. Okay, so for the therapy, I'm going to do a totally different video. So, come back up here. See what time is. Oh yeah, we're good. Okay, so I was going to pull up some cool videos. So let me go ahead and please hold.
Hey guys, welcome to another video from PT Final Exam. Today we're going to be talking about the pulmonary drainage positions and just quickly review what you need to know for the test on the NPTE when they are talking about the pulmonary drainage positions. So I've got a couple of diagrams here, going to go over each of the segments in order. Hopefully we'll be able to keep it all sorted out. And honestly, that's just the hardest part of this whole thing, is just keeping it all straight. All right, so first off, we're going to start with the upper lobes, the apical segments, which are up at the apex of the lungs. The biggest thing here is that the patient is actually in a seated position, and they're leaning back about 30 degrees. And so they're in a seated position, leaning back. This image isn't quite right, but leaning back about 30 degrees. And then you're going to be clapping between the clavicle and the top of the scapula. So that's actually going to be on the rear side here. You're going to have them lean back, and you'll be tapping up between the clavicle and the scapula on the top end. Basically just hitting those apical segments, and you can hit bilateral, both right and left, in this position. So those are the upper lobes. Now as we talk about the posterior segments of the upper lobes, we're going to have the bed flat again. This time the patient is leaning forward 30 degrees, and the therapist claps over the back bilaterally. So again, they're going to be clapping about right there. Remember, when you're clapping, you're using a cupped hand. And as you use that cupped hand, you'll be able to help percuss or create percussion, allowing the drainage in the lungs to start moving, using gravity to assist getting the drainage out of the lung segments and into the bronchioles, and trying to get them up and out of the system. So that's the upper lobes, posterior segments. The patient is leaning forward 30 degrees. The upper lobes, anterior segments. So this is on the anterior portion of your chest. So this time you're going to have the person lying supine. They'll actually be in a kind of a hook-lying position. So you'll place a pillow under their knees, mostly for patient comfort. Have them flat. And then you'll be clapping between the clavicle and the nipple area, so a little bit higher up on the chest. And be using that cupped hand again and clapping, trying to get the drainage out of the upper lobes in the anterior segments. So the right middle lobe, this is where things start to get just a little bit funny. You elevate the feet 16 inches. So 16 inches of elevation on the feet. So this is what's called a Trendelenburg position, where the head is lower than the feet. So then you'll have them lie on their back, but then rotate a quarter turn up. And so, for instance, if we're working on the right middle lobe, like what we have in this picture, the right middle lobe, we'll have them lie on their back and then rotate about a quarter turn, or about 45 degrees. We'll stuff a pillow up underneath their hips. As you can see, that's what this is. There's a pillow stuffed underneath them that is helping them into kind of a quarter turn position. You'll have your knees flexed, again, just for comfort, and trying to stick probably a couple pillows here up between the knees. And then the therapist will clap right over the nipple area. And so just a consideration when working with females or with the breast tissue, you'll be doing the clapping just immediately below or immediately above the breast tissue, trying to get to the rib cage as much as possible in that area. Okay, so that's the right middle lobe. Talking about the left upper lobe, so now we're talking about the left side. It's essentially the same as the right middle lobe. We're going to be about 16 inches up on the feet. You'll be lying down, and then you'll be quarter turned to the right with knees flexed. Again, you can see how that's very similar to this from the last picture. You'll be clapping the hands over the left nipple area. So again, remember, you're trying to rotate the person into position so that the fluid or the discharge inside of their lungs is in a gravity-assisted position that will help it come out of the lungs. All right, so now talking about the lower lobes, this is where we have the feet of the bed elevated 20 inches. So that's a big difference here. When we're down into the lower lobes, remember, you're elevating the feet just a bit more. So it's even more of a Trendelenburg position. They'll be side lying. A lot of times you'll see the image with the hand abducted over their head. So it's in full abduction, just so you can get to that, get to the ribs. So you're because the therapist is clapping their hands over the lower rib cage area. So you have the person abduct their arm to get it out of the road. They're going to be side lying, arm raised in abduction, clap over the lower ribs. Now this is the same left versus right on these lower lobes, anterior basal segments. Same left versus right. You're going to be raised 20 inches. You'll have the arm abducted, and you'll clap the hands over the lower rib area. So now talking about the lower lobes, the lateral basal segments. So remember, we were just talking about the anterior basal segments. Now we're talking about the lateral basal segments. The key difference here is, well, things that are the same are you are still elevated 20 inches on the feet, so still in the Trendelenburg position. The patient is prone, but then a quarter turn rotated upward. And so, for instance, if you're working on, you have them, you're trying to work on the right side, you'll have them lay flat and then lift that right side up just a little bit. Remember, you're trying to, just think of trying to drain water out of that lung, or drainage out of that lung. And so if you're working on the right side, you will lift that right side up about a quarter turn. Again, you'll have the arm up into abduction. The arm in abduction allows you to clap your hands over the uppermost portion of the lower rib segments. So again, just remember, you're trying to get this portion of the lung, and so the lower ribs, maybe the uppermost portion of the lower ribs. And this technique is the same left versus right, just like the other one. Like when we were talking about the anterior basal segments, it's the same left versus right. The lower, and I should make sure to make this distinction, it's not the exact same, it's just the opposite side lying. Remember, you're going to be raising the right portion. If you're working on the right side of, or the right lung, you'll have the right side of the body lifted. If you're working on the left lung, you'll have the left side of the body lifted. Okay, so talking about the lower lobe's posterior basal segments. So we've talked about anterior, lateral, now posterior basal segments. You'll have the patient in prone. You'll still be 20 inches up. So you can see a theme here. All of the lower segments have the foot of the bed elevated 20 inches up in this Trendelenburg position. You will place a pillow under the hips, mostly for patient comfort, and the therapist is going to clap on the lower ribs close to the spine on each side. So obviously this is good for both right and left when they're in this position. The posterior basal segments. 20 inches up on the feet, patient is prone with pillow under their hips, and the therapist claps over the lower ribs close to the spine on each side. So then finally, the lower lobes, the superior segments of the lower lobes, you'll have the bed flat with the patient being prone with two pillows underneath their hips. So again, you're trying to just raise up their middle, or in the hip area, trying to raise that up just a little bit. And you'll be clapping your hands over the middle of the back at the tip of the scapula bilaterally. So the bed is flat, patient is prone with two pillows under the hips, and the therapist claps over the middle of the back at the tip of the scapula bilaterally. So that helps you get both sides of the lungs. All right, just a few precautions about pulmonary drainage. In the Trendelenburg position, as you remember, Trendelenburg is just where the head is lower than the feet. So when the head is lower than the feet, you have to be very cautious of congestive heart failure and hypertension. Just what it does is it creates extra fluid buildup in the head, cerebral tissue. You can get some pretty dramatic problems when you have too much pressure inside the head. Anyone with pulmonary edema or shortness of breath that's made worse with postural changes, and remember, these are precautions, not necessarily contraindications. So if a person has severe shortness of breath, when you put them into a supine or a Trendelenburg position, obviously you'd either need to change position or choose some other technique to get the drainage out. Obesity, abdominal distension, hiatal hernia, nausea, a recent meal, you can get some heartburn, just when you have the person in a Trendelenburg position. For side-lying positions, again, you just want to make sure there's no graft site. So if there was an axillofemoral bypass graft site, where they grabbed some of the arterial tissue from the axilla, that might cause some problems, as well as arthritis, rib fractures, or any sort of shoulder dysfunction, just discomfort lying on the side. So those are the precautions when it comes to pulmonary drainage techniques. Here's the source. And so just to review all of it one more time, we're going to go real fast. We're going to go back to the very beginning. The upper lobes, you'll have the bed flat. Patient is leaning back.
Okay, I like that video, and I also like this video here.
Postural drainage is the use of unique body positioning to enable gravity assist in the drainage of certain lobes and segments of the lungs. These positions can be enhanced when used in combination with assistive airway clearance techniques such as percussion, vibration, or shaking. If your patient is prescribed bronchodilators, instruct them to take these medications prior to positioning. Patient positioning should be maintained for at least 5 to 10 minutes. Following termination of positioning, the patient should be encouraged to cough or huff. The clinician must be sure to assess for the efficacy of treatment by auscultation of affected area of the lung prior to and following treatment. The clinician should monitor the patient throughout the treatment to assess for signs of intolerance. Clinicians should be aware of postural drainage precautions such as pulmonary edema, hemoptysis, massive obesity, large pleural effusion, and massive ascites. Clinicians should also be aware of relative contraindications for postural drainage, such as increased intracranial pressure, hemodynamically unstable patients, recent esophageal anastomoses, recent spinal fusion or injury, recent head trauma, diaphragmatic hernia, and recent eye surgery. Now we will look at several postural drainage positions that may be appropriate for your patient population.
For the anterior upper segments, your patient should be positioned supine with the table in Fowler's and a pillow under the knees for comfort. For posterior apical segments, your patient supine with the table in
Several postural drainage positions that may be appropriate for your patient population.
For the anterior upper
So anterior upper lobes, compare and contrast. Upper lobes anterior, and looks like these guys have their patient positioned a little differently.
segments, your patient should be positioned supine with the table in Fowler's and a pillow under the knees for comfort. For posterior apical,
Okay, so this shows flat. They showed it elevated. Let's see, they're going to go to
segments, your patient should be positioned in long sitting with the trunk flexed and a pillow under the knees for comfort once again.
that looks like they did this one. Yep.
For anterior segments, your patient should be positioned supine with pillows under the knees for comfort. For right posterior segments, your patient is positioned prone with pillows propping up the right side of the trunk. For left posterior segments, your patient should be positioned.
What I like about this video, not so much pay attention to the area of the lung and the position of the patient, but what I liked about this video is how he showed how a treatment table can be placed in Trendelenburg, which I never knew before, so pay attention to that.
In prone with the table in Fowler's position. Pillows on the right side of the trunk. The table should be positioned in 12 inches of Trendelenburg. All Trendelenburg positions have a set of their own contraindications and precautions which clinicians should be aware of before placing their patients in.
Pretty cool.
For the left lingular, your patient should be positioned in supine with pillows propping up the left side of the trunk. The table should still be positioned in 12 inches of Trendelenburg. To reduce the risk of aspiration, patients should refrain from eating at least 30 to 60 minutes prior to treatment, or treatment should be scheduled prior to meals. For anterior lower lobes, your patient should be positioned in supine with the table in 18 inches of Trendelenburg, with pillows under the knees for comfort. Remember, this position is very high, so patients can be intolerant of this. For the right lateral segments, your patient should be positioned in left side lying, with the table positioned in 18 inches of Trendelenburg. Pillows are held in the right arm and placed between knees and ankles for best comfort. To improve the efficacy of all postural drainage positions, patients should be well hydrated before treatment.
So, like I said, I like that video because of how it showed how you could change a treatment table into a Trendelenburg position. And I never seen that before, so that was kind of cool. It was. Alright, so We are going to stop the video here, and part 3 is going to be over therapy ed section, which is about 30 slides. Catch me on part 3.